Dr. Albert, tell me, can you give us an update? This started January 1st?
January 1st, we started with an outbreak at the nursing home, Hope Street Terrace Long-Term Care in Port Hope. At that time, it was only contained, the cases of COVID-19 were contained to one unit, and the home has done an amazingly good job, very strong administration. They've kept the outbreak to the one unit. So we have one unit where out of 20 residents, 2 have passed, 2 are okay, and the other 16 all have COVID, several of whom are very sick. Most of the staff that work that unit have now developed COVID as well, so they're all isolating at home. I don't know how ill they are, but they've had to bring in staff from out of the area to cover it. But my concern is that there are 60 other residents that are currently okay, but that are living in a building where they share, you know, everything. It's a long-term care facility. It's considered very high risk. And those 60 people and the staff that work with them are sitting ducks to get infected because there is now an outbreak in the home, and they have not been offered the vaccine. Since we talked last week, Pete, I have learned from a very reliable infectious disease expert that vaccinating those people would definitely make a difference, definitely could save lives by getting that vaccine into both the residents and the staff of the remaining parts. But there has been absolutely 1 week since I spoke to you last week about getting vaccine. Nothing whatsoever has happened. It's very frustrating to me. We have no date even to look forward to other than the fact that Doug Ford said by February 15th, but that's still a long way away. Frustrating to me because I live in Durham where we're doing this interview. There's a nursing home right across the street from me, and nobody there has had a case, but they were all vaccinated last week. I also work at a nursing home in Oshawa where almost every one of my patients has in fact had COVID, but they are going to be vaccinated within the next 2 weeks. And meanwhile, I have these 60 residents who have not yet had an infection, who are extremely high risk of dying from an infection, who are in a long-term care congregate facility, and who should be, top priority. I was told after our interview last week that, homes and outbreak would be given priority, but so far it's been a whole week, and I just spoke to the administration, and we don't have any date available.
If I get this right, too, as we spoke last week, it's basically because, as we're standing right now, this is a red zone.
Well, that's what's frustrating is Durham is considered a red zone, so therefore, the government is proudly saying that all their homes have been vaccinated, which is true. But it's a 20-minute drive to Port Hope where my facility there is, and it seems like someone's drawn a line in between Newcastle, Ontario and Port Hope, Ontario, and suggested that the people on the, east side of that line somehow don't matter as much as the people on this side because they are not being offered anything. And it's I don't know, I realize they have to prioritize the vaccine and they don't have enough, but these people are in a home with an outbreak. They are extremely high risk, and I think they totally should be looked after.
Disheartening, frustrating as a doctor to see this because there's basically, and as I say, I don't want to put words in your mouth, there's really nothing you can do.
No, I've been working really hard. I've been going in every second day to the home to try to offer the best care I can for the people who have COVID. The home is doing everything they can do to keep it from spreading, which includes not letting me go to the rest of the home to look after my other patients. We're doing that all by phone because they're trying with all their might to keep it from spreading. But I certainly, as of last week, I thought, could we please at least try to offer these people the vaccine? And then since I've heard that it could actually make a difference and save their lives, it's even more urgent that they be offered a vaccine and get it promptly. And the fact that it seems like my speaking out last week made no difference at all, nothing's coming our way. I'm not sure if it is very frustrating because as a physician, I know that there's something out there and I know that my patients across the street got it. And I can't offer it to my other patients, and they're equivalent wonderful people. They shouldn't be penalized just because they live 20 minutes down the road.
I was going to say 20 minutes seems to make a difference between, I guess we can say, or is it okay to say 20 minutes makes a difference between life and death?
Well, it could, yes. 20 minutes could make a difference between life and death, and absolutely. And the reality, too, is because this home is so close to a red zone, because it's only 20, 30 minutes down the highway, the nurse who brought the first COVID infection into our home, in fact, resides in a red zone. So realistically, this home, even though it's officially not a red zone, the staff come from a red zone. So to say that you're drawing that line just, it defies logic.
The thing with that is, too, it's well known publicly. People come from red zones to ours. People come from ours to red zones. So it's nothing new. It's just the way life is. That people work in the city. People in the city work in,
Well, especially right now, frankly. I mean, they brought in a whole bunch of staff to replace our sick staff, and they're all coming. I'm sure most of them are coming from red zones as well. So, yeah, calling it red versus gray versus white. I mean, I don't see how it works. And the other thing is that they're talking about limited number of vaccines, but we know full well, my husband is also a physician, he's delivering vaccines. We know every day there are leftover vaccines at the end of a shift that need using. So we know that given that there is a shortage, there is also potential to wiggle around that shortage somehow. And we know that, again, this home all got vaccinated. We know that my husband did a whole retirement home worth of vaccines this morning. So we know it's been done, and it's just not been done at this high-risk location because of where it is on a map.
basically, I don't know how to say this other than, basically, all you can do is just watch and wait.
Totally can just watch and wait. And I mean, the only other thing I question is whether I should be going to other media other than the local media. I have debated that. I've been advised by the administration that they're working very hard with the public health department. They're working hard with the local the LHIN, the LIN. They're trying to get things going, and they sort of don't want to put people's, back against a wall. So I've been asked not to go any further. But I got to tell you, a week later, when I heard that nothing whatsoever has been done, that's why I reached out to let you know that nothing whatsoever has been done. And I am debating at what point does good faith just have to be stepped upon, because these people that I care about and that are, my patients are being neglected.
So we went from one person to how many now?
So we now I have 16 patients with COVID on the floor right now, about 6 of whom are quite ill. I've lost 2 patients to COVID in the last 2.5 weeks. And I have 2 patients in that unit who are still not infected, and I have, I believe, 60 patients in the home that are at high risk but not yet infected. I'd like to keep them that way.
It must be the anxiety, I would think, when you mention that, the anxiety of the 2 patients that aren't infected in that unit would be incredible.
I'm sure those 2 patients and their families are duly nervous. Of course they are. And I mean, I think all the patients who are on that unit, it's very threatening for them. One of my patients, when it first came around, he said, please doctor, give me my vaccine. And I told him, well, we can't. And then the next day, frankly, he tested positive, and I asked him how he was doing, and he said, Doc, I'm preparing my will. How tragic is that, right? Yeah. And at the moment, he's on oxygen and he's quite ill. I'm hoping for the best. But it's very scary for the people who have it, the ones who don't have it on the unit, and frankly, it's got to be very scary for all the staff. And the thing is, the home's doing everything they can, but we're talking about, one bookshelf full of charts. We're talking about one nursing station. They're trying to separate these things out. But you have to, even when I leave the unit, I have to walk down a hall of patients who are not infected to get to the staircase to get me down to the stairs. There's no exit from that unit. So, I mean, it's a sitting duck. And everyone's doing everything they can. We're washing crazy, wearing all the gear, doing everything they can. But the situation remains very, very flammable, I would call it.
Were you satisfied with the response that you got from the MPP?
No, I mean, the MPP told me that they have a shortage of supply, and he told me that, they have a committee trying to decide where these vaccines should go. To be honest with you, I spoke with an infectious disease expert after our last interview who sits on the committee. And his impression was that they're listening much more to public servants and to ethics people as opposed to physicians. He felt the physician voices were not necessarily being heard loud and clear. And when I told him the situation and asked him, do you not think this home should get priority? He told me definitely it should. So, I mean, the MPP told me he's doing everything he can. I appreciate he's only an individual, he's only one MPP, and you got the public health department, you got the LIN, you got all these different voices. But I'll tell you, every time I read on the news how proud we are that we're getting, that GTA, Peel, and Durham are almost finished their vaccine campaign in long-term care, and they're doing retirement homes as well now. And I know a lot of my patients who are essential visitors, who are actually healthy younger people, but who visit people in long-term care in GTA, Peel, or Durham, they've also had their vaccines. So I'm seeing a lot of people getting vaccinated in the last 3 weeks, and yet my 60 particularly vulnerable residents and the staff who care for them have still not got a date.